Okay. We presented the case of Mrs. H earlier. So, number one would be which TCM organ is primarily implicated by the vertical crack in the midline of the tongue?
Middle vertical crack, it is plain stomach deficiency.
Okay. In the analysis of Mrs. H, the red points at the tip of the tongue are interpreted as an early sign of heat in which organ?
Red pot at the tip is called heart.
Which of the following lifestyle factors contributed to postnatal chi injury in Mrs. H, according to the case analysis?
Irregular eating habits.
Irregular, yeah. Okay. What is the equivalent of postnatal chi in Western medicine?
Energy
Um,
reserves after birth.
Okay. Which pulse qualities were noted in Mrs. H's examination?
Slightly
Slightly
rapid,
rapid
simple,
and
choppy.
choppy.
Okay, that would be choppy. The rootless coating on the posterior third of the tongue indicates a deficiency in?
Kidney.
Yes. So, rootless coating. In the discussion, the authors linked the tongue to disharmony between fire and water. Which TCM elements to fire and water, very easy, correspond to respectively?
Heart and kidney.
Yes.
Kidney.
Which acupuncture point combination was reportedly used to harmonize communication between heart and kidney in the treatment?
R7 and KT3.
Shen.
You see, that's how. Okay. Of course, you have
Shen.
to look for heart only and kidney.
Kidney.
The patient's occasional numbness and tingling of the right arm attributed to deficiency in which organ's blood?
Liver blood.
Yes. Which TCM diagnosis combines both slight spleen chi deficiency, blood deficiency, and constitutional weakness of the heart?
Plain heart, dual deficiency.
Okay. The long, narrow, reddish tongue, slightly yellow, thick, greasy coating, described for the 42-year-old female, most likely indicates which predominant TCM pathology?
Pag may yellow, heat with injury to fluids.
Okay. In the 38-year-old female case, which symptom directly reflects internal wind?
Atrophy and pain of muscle. Facial
Yes.
muscle.
Midline crack over the entire tongue body in the 38-year-old case suggests deficiency in which organ's yin?
Kidney,
Kidney.
Which Western medical condition was diagnosed for the 38-year-old female?
typical progressive vascular disease.
The greasy coating on the tongue is most often associated with which TCM pathogenic factor? Greasy coating.
Greasy
Damp
coating.
Damp phlegm. Which of the following best explains the link between perfectionist attitude and heart heat?
Emotional overactivation of the heart.
Right.
So all
Sir.
perfectionist people out there, take care of your heart.
Um,
7. In the case of Mrs. H, the phrase functional infertility most directly corresponds to, okay, functional infertility, yeah, because of the nature of her job, no?
Blood
Mm-mm.
deficiency obstructing the uterus.
Yes. Because you are going to have kidney yin deficiency, and we all know that uterus depends on the kidney for blood, right?
Blood, yes.
Yes.
So overwork women can have issues with fertility. Which TCM pattern would most likely present with headaches with tight neck muscles plus red tip of the tongue?
Liver fry rising.
Okay. Do you agree?
Yes.
Okay, yeah.
Yes, doc.
Because red tip. Yeah.
Yes.
Mhm. If it is only hit in the liver channel, it will not really. Okay. Yeah. The slightly rapid pulse in Mrs. H is termed sure. In pulse theory, rapid pulse generally indicates which condition?
Heat or young activity.
Or young. The long tongue body reflects constitutional long tongue body. Yeah, I'm sorry. Yeah, because our topic is long tongue, no?
Na
Long
po.
tongue and with the crack. Constitutional tendency toward development of heat in the heart. Which constitutional type does this describe?
Fire type
Fire
constitution.
type. Which of the following is not a typical effect of excessive coffee consumption?
Shortening the spleen.
Yeah, it will not strengthen the spleen. Okay. In the 38-year-old case, the old yellow coating is most indicative of which chronic condition?
Long-standing
Long-standing
density
condition.
accumulation.
Okay. The phrase internal wind in TCM often signifies which of the following pathophysiological processes?
Ascended young leading to tremors and convulsions.
So if you have tremors and convulsions, you will have that's internal wind.
Eternally.
Why is it
Tremor.
ascendant young? Because there is liver yin deficiency or liver blood deficiency. Okay. Which of the following outcomes that is why you should always ask what is the nature of their job, no? So if you have a person who is busy all the time because the job is very high paying, there is always the possibility of internal wind. And internal wind, especially tremors, will be very evident. Okay. And we all know what organ is first affected when you have internal wind. Which of the following outcomes directly supports the efficacy of the treatment described for Mrs. H?
Birth of healthy baby
Happy
to sleep.
baby.
So for those who want to have babies, try not to be too stressed. The slightly pale aspect of a tongue in TCM primarily suggests deficiency of which substance?
Blood.
Yeah, blood. The long, firm tongue body noted in the 38-year-old female indicates which underlying condition?
Severe kidney yin depletion.
Okay. In the 42-year-old female case, the lack of appetite is directly linked to which TCM organs dysfunction?
Spleen.
Yes. Which of the following best describes the therapeutic principle of harmonizing communication between heart and kidney?
Balancing fire and water to restore physiological rhyme.
Yeah, this is important, especially if you see a red tongue, that's definitely uh very weak. No, yeah. The fire of the heart is not going down to the kidney. Okay, so there's too much fire. The slightly yellow, thick, greasy coating, most commonly associated with the accumulation of which pathogen?
DAP heat.
Which of the following is a hallmark sign of blood deficiency in TCM tongue diagnosis?
Pale color.
Okay, very good. As pale as paper. Which TCM organ is primarily responsible for governing the channels and vessels and thus implicated when tingling and numbness occur?
Liver.
Yeah. In the context of these cases, overwork most likely leads to which TCM pathological mechanism?
Overwork. Nagkakaroon po ng chase stagnations transforming into heat.
Yes. The phrase functional infertility is best interpreted in TCM as a dysfunction of
Blood and
Blood.
kidney systems coordination.
yeah, it's like this, no? If you are too busy in life, especially if you're very emotional, you will have liver blood deficiency, so there will be liver yin deficiency. So your liver will always borrow the essence from the kidney, right? So you keep on depleting your kidney essence
Okay.
because you lack liver blood. Why? Because you have liver yang rising. So for people who are very emotional, who are too busy because they have a very uh, high paying but too much pressure, a job that is so, you feel so pressured, so you will deplete your yin of the liver. And so you keep borrowing essence because the essence will transform into yin. So you deplete your kidney essence. So um, the uterus also depends on the kidney for blood supply. So there. Which acupuncture point is traditionally used to clear heat from the heart and calm the spirit?
Shenmen
Shenmen.
or heart
Heart 7. Which therapeutic modality is a form of Chinese bodywork focusing on meridian pathways?
Tai Chi Chuan.
So you might also want to do Tai Chi. Long
Tai
tongue with a vertical crack can also be seen in which classical TCM disease pattern?
Chronic chi
chronic chi
deficiency.
deficiency transformation.
Okay, what do you think will be the appearance of a tongue with acute wind cold invasion? Go.
And cold.
Hmm? Can you describe the tongue? Acute wind cold invasion. So you're going, will you expect a white coating? Actually, you don't see
Oh,
anything.
what
You don't see
the
anything.
tongue?
Yeah.
Wala kang makikita dun, Dok eh.
Yeah. It's also thin and white. Okay. Only the symptoms. Okay. What about damp cold? What is the appearance of the tongue?
White. White coat.
Okay. How
White
would you
thick.
describe? Thick white? Yes.
Thick
Hmm.
white.
What about blood stasis in the liver?
That's
Can be
Purple
purple.
tongue.
Purple on
or
what area?
Purple tongue.
Especially the
violet.
sides.
Especially the sublingual veins.
Yes. And also the sides of the tongue. Wow, very good. In TCM theory, what does heat in the heart most commonly affect emotionally?
Joy
Joy
and
and restlessness.
Hmm. Which of the following statements about kidney yin deficiency is false?
it commonly presents with bright red tongue.
Tongue tip.
Yeah, okay. That's heart heat, right? Uh,
Hmm.
how does, okay, can you describe to us the tinnitus in kidney yin deficiency as contrasted to liver yang rising?
Lower, low frequency ringing.
Okay, low pitched or low
Low
frequency.
pitch
Very good.
pala.
Well, if it's liver yang rising, it's high pitched and there is
High
bitter
pitch.
taste. Okay. Presence of heat with injury to fluids suggests depletion of which TCM element?
Water.
Of course. In the 38-year-old case, if you still remember, the excessive use of willpower, Allah, you see, if you use your willpower too much, okay. Okay, will deplete which organ's essence? What kind of
Kidney.
kidney? Okay, now I know.
Kidney, Dok.
Ano ka wala? Which of the following best explains why sleeping problems are linked to both heart heat and kidney yin deficiency? Go.
Heat agitates the spirits while yin
Fire.
helps to
Kills
anchor.
the answer.
Of course.
Fire and water
Which
problem.
TCM diagnosis would most likely be assigned to a patient with red tip, rapid pulse, insomnia?
Siyempre,
Heart
heart fire.
fire.
Galing.
Fortune.
You're so good. Greasy coating.
Yung
42-year-old suggests excess of what?
Flame
Phlegm.
down.
Phlegm dump. You see? Which of the following is a primary function of the spleen in TCM that, when deficient, can lead to irregular eating habits, exacerbating pathology?
Transform.
TNT. Absorbent transport.
Okay, Sir Mark, what is irregular eating habit?
Maya-maya nakain. Kaya,
Or
You
no,
eat
intermittent
anytime.
fasting is
You don't. You
intermittent fasting is
Nakain.
considered
Is it true,
irregular.
Sister Rosa, that you should always have time for eating? You just like now you eat at 11, tomorrow you eat at 2 p.m. I think
Yeah,
that's not irregular eating. Yeah.
I have irregular.
So you should
Like,
have a schedule. You should also know
yes,
when not to eat.
yes.
Okay, let's ask
Three
our
Yes.
meals. 3 meals a day.
yes, 3 meals a day, but same time each day. You should not
Yeah,
confuse your
That's-
your whatever you call it, your energy
yes.
pathway. Yeah. Same time each day. Okay, the 38-year-old game.
2 meals.
So that
Acceptable.
means Sister Rosa will have to eat at 5 p.m. So she's already late by 1 hour.
She's hungry. Sister Rosa is
Anyway, we're
hungry.
almost done. The 38-year-old case, red, very narrow, contracted tongue body, is most characteristic of
heart fire, burning, emptiness.
which modern research method could best correlate the long tongue sign with an objective physiological measurement?
Infrared thermography of oral
Okay, this is the
mucosa.
future. So in the future, I think practitioners will be
Okay.
equipped with this technology, no? The term postnatal chi is most closely related. I think this was already asked. What is your answer here?
Micronutrient
Micronutrient.
reserve
Yeah.
after
Which of the following best describes relationship between overwork and chi stagnation in TCM?
Siyempre, nag-exhaust yung chi natin. Excessive
activity.
activity leading to blockage.
Yeah, of course, when the chi is depleted, there is no flow, right?
Yes.
Yes, Doc.
Which of the following patterns is most likely to produce headaches with tight neck muscles in a person with fire-type constitution?
Liver
Liver.
Liver.
Yes. And the finally, so that Sister Rosa can already have her dinner. In the context of the cases presented, heat in the heart is most likely to manifest in which of the following emotional states?
Restlessness and anxiety.
Wow, thank you so much to everyone and congratulations. Sister Rosa, thank you so much.
Thank
And
you.
to all the
Thank you,
others,
Doc.
thank you for joining, even if you're not saying anything. Okay. I hope you will all join us again tomorrow. Thank you, Dr. So. Yeah, thank you. So this is for everyone, huh?
See you tomorrow.
See you tomorrow, hopefully. If
Thank you.
if I cannot if I will be late, I will
Okay.
let you know. We will postpone it on Wednesday, okay? Thank you so much, everyone.
Okay.
But I will
Thank
try
you,
to
Doc.
come
Thank you,
tomorrow, I'm sorry.
everyone.
Goodbye, everyone.
Thank you.
Bye-bye. Thank you.
Bye-bye.
Enjoy your
night.
dinner. Bye.